The Washington State Hospital Association says that the state's hospitals have been operating at a loss for 2 years. In 2022 alone, those losses amounted to more than $2.1 billion. The association says hospitals across the state have had to roll back services and put limits on capacity. And if something isn't done soon, some of these hospitals could close.
I always want to remind people that 2021 was not a great year. You look back in your memories, it was a pretty rough year for healthcare. So the fact that 2022 is worse is quite alarming.
Although revenue increased 5% year over year, total operating expenses increased by 9% in that same time period, leading to increasing losses. Multicare CEO Bill Robertson points to lower Medicaid reimbursements as a source of strain on its finances.
All of our hospitals in 2022 lost money on an operating margin basis, and our aggregate loss was $286 million. Clearly not sustainable over time.
Which is why Robertson and the WSHA are calling for state lawmakers to raise the bar for Medicaid reimbursements, bringing payments up to the level of the Medicare rate, which pays about 80% of the cost of care. And potential legislation could create a new direct payment program that will allow Washington to bring in more federal matching dollars to the state's Medicaid program.
We know that these programs exist in other states. We are working, we have complied with all of the federal rules of these programs.
The plan would only bring in an additional $1 billion, which falls short of the more than $2 billion in losses the state's hospitals have accrued. But Sauer says something must be done, because Washington's hospitals are already rolling back key services that patients need.
Patients who are not getting knee replacements, heart valve replacements, colostomy reversals, slow cancer tumor removals, those are huge impacts on patients' health, both physical and mental health. So it is a big deal. I think it's a good question, but I think sometimes people miss the bigger context of if the hospital is cannot allow access to care, that is the biggest adverse event a patient can ever have.
Now, even if lawmakers pass key bills, the Washington State Hospital Association says it'll be a year before Medicaid payments are increased. From Tacoma, Lionel Donovan, King 5 News.